Good afternoon, everyone. I'm Vida from University of Ghana, and this is an ongoing research. And you can see some names beneath there. They are our research team, which is headed by Prof. Ahmad de Graft Akins. And I'm here to present on enhancing heat resilience and reducing air pollution through community-driven adaptation in low-resource urban settings. This will be my presentation outline. We know that climate change is intensifying extreme heat and air pollution globally, but these impacts are not evenly distributed. Urban poor communities are especially vulnerable due to limited infrastructure, crowded living conditions, and environmental neglect. In places like Gamashi, common practices such as use of solid fuel to cook and open burning further deteriorate air quality in the community. The community already faces compounding challenges, including heat, poor ventilation, and persistent air pollution. Despite these challenges, local research on how communities are responding to, especially in West Africa, are very limited. Moreover, community knowledge, and in particular, the voices of adults and children, is often underutilized in planning climate adaptation and environmental intervention. So this study, which forms part of the broader HAVIA project, which also stands for Heat Adaptation Benefits for Vulnerable Groups in Africa. HAVIA, someone may ask, what does it do? The aim is to address evidence gaps by gathering high-quality data on physiological and mental health, along with climate, environmental, and qualitative information from vulnerable urban communities. The project is implemented in 4 communities across 2 African countries, that is Ghana and South Africa. And in Ghana, we're working from 2 communities, that is Gamashi and Nkwantakesi. And then in South Africa, Kailicha and Impego. The main aim of the study is to explore how residents of Gamashi who lives in Accra perceive and respond to health and social impact of extreme heat, as well as air pollution, and identify community-driven coping and adaptation strategies. Gamashi is a coastal urban poor settlement in central Accra comprising of Jamestown and Osha. People also call it the twin communities. It has a population of over 6,000 and long-standing infrastructure challenges. Educational levels are low, especially among the adults, but with basic education among the young ones, but school dropouts among girls because of teenage pregnancies. Their livelihood are mostly informal, dealing in fishing, fish processing, petty trading, etc. This research was designed using exploratory cross-sectional design, employing a qualitative research approach to explore community perception and experiences for data collection. We purposively sampled participants, and the older adults were sampled from the HAVIA project, with children participants selected from Jamestown Children's Health Club in Accra. Some of the children are grandchildren of an NCD Health Competent Self-Help Group that we have worked with them for over 10 years now. Data was collected through focus group discussions with both groups And with the children, drawing activities were used during their focus group session to support their expression and experiences in heat and air pollution. So sessions were actually conducted in Ga language, and they were all audio recorded with consent and later transcribed and translated into English for thematic analysis. All ethical approval were sought for. The participants in this study involved 44 adults, both male and female, with an average age of 48, and 19 children, both male and female, with an average age of 13. All the adults had varying educational level, with the children mainly primary and junior high school. In terms of our findings, they are organized under 3 broad themes: community, environmental, knowledge. But with this, the first theme explores how adults and children in Gamashi understand and describe their environmental conditions. Participants across both groups reported that the heat intensity has worsened, and they attributed this to seasonal changes. That is the first one, and deforestation and loss of trees, where most of them refer to the past to the present. And many of them describe how the sun feels hotter now and intense compared to what they felt during their past. But this was actually from the elderly group. The use of metal roofing, which was also reported by the adult group, shows that they now know that the metal roof worsens the heat and making their homes very uncomfortable for them. However, both adults and children highlighted commercial biomass cooking as common in the community, which also produces air pollution in their homes. But in terms of the air pollution, both adults and children identified several everyday sources. That is burning of ties at the old abattoir that is within the community. This abattoir is not supposed to be existing because the government made a new one and made sure that they will all move to that new site, but they are still there operating. So the children and the adults indicated that this abattoir causes both heat and air pollution in the community. And cooking with firewood and charcoal was also mentioned by both groups as a source of heat and air pollution in the community. Fishing smoking by the women, which is a dominant work for women in the community, was also mentioned as source of producing heat and air pollution in the community. And then there is the mention of poor sanitation, whereby open rubbish burning, choke gutters, which releases foul smells and smoke in the air, into the air, were mentioned as part of or source of air pollution in the country, in the community, sorry. So this is a typical drawing of one of the children drawing sessions that they had, indicating the industrial pollution and heat in the community as one of their understanding of how this is polluting air in the community. In terms of their perceived health and environmental impact, it was grouped under 2 sub-themes, that is health impact and environmental impact. In terms of the health impacts, participants reported extreme heat exposure to smoke and heat, which is affecting their physical and emotional well-being in several ways. 1, respiratory problems were frequently mentioned, especially among the children. They talked about issues like blackened nostrils and persistent coughing, and also difficult breathing when the smoke fills the air. And the adult participants also mentioned the experiences of chronic illness like asthma and hypertension, which they mentioned gets worse and it's difficult to manage when the smoke and air fills the environment. A quote from participants is, I can't see. When they are burning things within the community, we tend to see the black soot of the smoke in the atmosphere. Then people start to feel it because it triggers asthma and other diseases. They also indicated that psychological distress is experienced, especially they feel anxious, tired, and unable to sleep due to both the physical and discomfort and constant exposure to the poor quality of air. Environmental impact. They also noted that soot builds on clothes and buildings and the constant smell of smoke in their homes, especially those living near the abattoir. So if you take a critical look at the picture there, this was taken in the community abattoir, where the locals use tires, old car tires and firewood to prepare the meat that they sell to the community. So these are some of the typical examples that the participants mentioned as sources of heat and then air pollution within the community. In terms of the community coping and strategies that they employ, they mentioned environmental challenges of heat and air pollution. Both adults and children shared a number of individuals and household strategies they use to protect themselves. One, they mentioned covering their nose and mouth. So the children indicated that if the smoke is coming too much, for them, what they do is if you don't have handkerchief, you use your nose, your dress to cover your nose. And whereby they don't have it and you can afford, then you buy face masks to wear. But this is a community that they don't have much money, so not a lot of people will be able to purchase the nose masks. And then staying indoors was also another strategy that they use. And during the heavy air pollution, if you stay indoor, it means you have to close your door, your windows as well. So some indicated that they stay indoors, but they also close their windows. So it means you'll be trapped in with the heat. And if you know Gamashi, the houses are so close with some not having windows and some having tiny windows. So if you stay in and close your door, it means you are going to feel the heat in there also. So the community did not just identify the challenges, but also propose practical solutions to improve the heat resilience and reduce air in their community. So the suggestions they mentioned fell into three key parts. They mentioned education, educating the people that engage in the abattoir practice, because this is human practice that they can stop if they know the impact on their health. It means they may stop. And they also said that not just for the abattoir people using the tires and the wood that they use to process the meat, but it should be a general community education where others will also know the harm that the activities that is going on is causing to the whole community. And then they also mentioned regulation and relocation of the abattoir. So this was mentioned by the children, where they think that the government should use force to relocate the abattoir people to a far place which is not closer to the community or any community at all that they can engage in that particular business. They also mentioned that there should be ban on the use of the car tire and rather focus on using LPG for preparing even commercial food in the community as well. And the last point that the participants mentioned was planting of trees, that is to improve the environment. And this, the children indicated that if this was done in the community, if the trees are planted, they would take their time and make sure that it grows by watering the plants. In Gamashi, you can count the number of trees in that community. I bet you you won't find it difficult counting the trees. So the children are eager for trees to be planted so that they take care of it. These are some of the drawings from the children. So you can see that one child drew, and where the abattoir people process their meat in the community. So, recommendation. This recommendation is coming from both the adults and the children, with a shared practical idea to help reduce the heat and air pollution in the community. So encourage the use of cleaner cooking fuels like LPG, improve waste management and stop burning rubbish near homes, and provide environmental education for all ages, and include children's voices in local planning and decision making. So in conclusion, I will say that residents of Gamashi, both children and adults, have a strong knowledge about their environment and are already adapting a creative way in solving their air and heat pollution. Thank you.